Hello, and welcome to the STAR Kids Screening and Assessment Instrument Training. This training will give you an overview of the SKSAI. We will talk about the different modules, strategies for collecting information and completing the items, the manual, and finally we'll provide some sample questions and practice. A lot of the information you will hear in the training is available in the STAR Kids SAI manual. It's a good idea to have a copy of the manual available during this training. You will also need to have a copy of the most current SKSAI to reference during the training. If you have any questions about the training or the instrument, you will find contact information at the end of the presentation. The assessment. The SKSAI is made up of 4 different modules: the core, the PCAM or Personal Care Assessment module, the NCAM, the Nursing Care Assessment module, and the MDCP, the Medically Dependent Children's Program module. We'll start with the core. The core assessment. This module covers a wide variety of questions aimed at gathering background information on the individual's health, functional status, services, and support systems. Responses to questions on the core trigger whether or not an individual receives the PCAM and/or the NCAM, and may also draw the assessor's attentions to topics that should be discussed further. The core tends to focus on the individual's current status. Some of the items in the core are also used to determine medical necessity for individuals requesting CFC services, or MDCP. The PCAM. If an individual's responses in the core seem to indicate that the individual may need attendant services, proceed with the PCAM. The PCAM is used to determine needs for both PCS and CFC services. The PCAM delves further into a child's health and functional status. This part of the assessment has look-back periods of 30 days. The NCAM. If an individual's responses to questions in the core seem to indicate the individual may need skilled nursing services, proceed with the NCAM. The NCAM focuses on identifying the individual's skilled nursing services. Additionally, the NCAM is used as part of medical necessity determinations for CFC. The look-back periods include the last 30 days unless specified. MDCP. If an individual indicates in the core that the individual has been receiving services in the Medically Dependent Children's Program or has been released from the interest list for MDCP services by HHSC, they will receive the MDCP module. The MDCP module consists exclusively of items that inform the Resource Utilization Group (RUG) cost limits for determining an individual's budget in this waiver program. These items were formerly found in the MN-LOC assessment and taken almost verbatim. The look-back periods include 7 and 14 days. Please also note that many of the questions are very similar in nature to the other items in the core and the NCAM, just with a different, often more narrow look-back period. It's important to explain to the child or youth and/or caregiver that while the items are similar, they serve a different purpose and are necessary for MDCP budget and planning alone, and not in fact used for medical necessity determinations. It should also be noted that you may be familiar with asking some types of these questions, and some may be new. Using the assessment. We'll begin by discussing the best way to gather information. The SAI is designed for use by assessors. The forms aren't questionnaires. The assessor should not go through the modules and ask respondents each question. The assessors use their judgment to determine the most appropriate source of information to complete each item. Sources of information may vary by item. However, in general, the individual, through observation and discussion, and the caregiver are the main sources of information. The assessor may need to gather information from both in order to decide which response is most accurate. For example, what's the child's date of birth? What type of assistance does the child receive with dressing? The assessor will often need to rely on professional judgment. The assessor may wish to gather other information to ensure accurate responses. They may need to view the Medicare card to record accurately the beneficiary number, view and count the number of medications, or review documents from school, HHSC, or another agency or provider. It's very important that you probe when needed. The assessment is focused on the individual's actual functioning. the assessor should not have to determine what is age appropriate. If information sources conflict on the proper response to an item, the assessor will need to use his or her professional skills to probe during additional discussion in an attempt to resolve any discrepancies. In the end, he or she will be required to make a reasoned, professional judgment about the correct response for a particular item. Some of the questions in the assessment will be of a very sensitive nature to caregivers and individuals. It's our recommendation that you use simple, straightforward, non-judgmental language. Address the individual directly but gently, if possible, and rely on your professional expertise. During the initial cognitive trials, we found that stakeholders valued these questions and felt that they were an important part of the assessment. If, despite your best efforts, information you need to code an item is unavailable and will remain unavailable, you should record a 9 in the response box or skip the item if the 9 is not available as a coding option. We urge you to use this approach sparingly, if at all. If you do use it, you should write an explanation about why the information was unavailable in the free text item. Is there anything else that would be helpful at the end of the section of the instrument that it is available? Please also note that there are some items that are mandatory requirements for the SAI and cannot be skipped. In those cases, use your best professional judgment to code the fields and then clarify your response in the same free text item at the end of the section. Common items. The majority of questions in the instruments will be coded, where you enter a number into a box that corresponds to a value for that question. There are some questions where you will directly input a value and some open-ended questions. Throughout the instruments, you will encounter similar types of questions multiple times. The same general instructions can be used to respond to those questions. Other. These types of questions allow you to capture an answer choice that's not already included. You'll input the code that applies and then include a brief description about the item in the space provided. And is there anything else? At the end of some sections in the instrument, there's a general question asking for any other relevant information that's not covered in this section but may be important to know. This is also a good place to record something that may be beyond a time frame or look-back period in the instrument. For example, an individual mentions an upcoming surgery scheduled 6 months from now, falling outside the 90-day period in the associated question. You may feel that the surgery would be helpful to know in the future, and you may include the information about it in this question. Using the manual. Take time to review the manual. There is an acronym glossary in the beginning, and the first 12 pages give helpful hints to conducting the assessment. The rest of the manual is devoted to more specific item definitions that might be useful to reference during the assessment. Now we'll talk about the core. The core covers most of the background and general health information of the individual. Section A, Identification Information. Section A is devoted to collecting demographic information about the individual, their residence and residential preferences, and their physician. Many of these questions should be familiar to both assessors and those being assessed. Section B, School and Work. Understanding the educational and vocational settings an individual may be involved in can help determine the need for more or different services in the home. Section C, Goals for Care. The individual and caregiver are important members of the healthcare team. It's essential to understand what their goals might be. This could be a starting point to develop a person-centered plan of care or services. These outcomes may relate to almost anything, including improved functional performance, a return to health, increased independence, or an ability to maintain community residence. Section D, Diagnoses and Healthcare Utilization. Section D covers a variety of topics about the individual's diagnoses, medical care needs, and assistive devices. Section E, Caregivers and Social Supports. Section E provides a place to include information on the people in the individual's life and household. Section F, Strengths and Challenges in Performing Daily Tasks. This section contains an overview of the individual's functional status and communication skills. Section G, Nutritional Status and Concerns. Section G provides an overview of the individual's nutritional intake, including the most recent and available height and weight measurements. Section H, Current Treatment and Procedures. Section H starts with questions aimed at understanding the individual's medication regimen. followed by pinpointing services and treatments the individual has received, and ends with a discussion on the potential for physical improvement. Many of these items are helpful for determining a plan of care. Additionally, many of these items serve as triggers for the NCAM. Section I, Mental Health and Behavioral Concerns. Section I is devoted to capturing the individual's mental health care use and presence of behavior indicators. So now we're going to look at a few sample questions from the assessment. We're going to look at questions A18 and A19. Mark is an 18-year-old with IDD who lives in his parents' home with his little sister. You're conducting the assessment with Mark and his mother. Mark mentioned that he would like to move into his own apartment at some point. His mother disagreed, preferring that he stay at home. So how would you code A18 and A19 for Mark? I'll give you a few seconds to think about that. And the key here is that every item should have a response. Okay, so for question A18, we would code A18E with 1. Mark lives with his family in his parents' home. We code it this way because Mark is 18 at the time of the assessment. If he were a minor or less than 18, we would code A18B as 1. A minor living in his own home with his family. Looking at A19, we would code A19A as 1. Mark stated that he would prefer to live alone. It's important to note that this may or may not become an action item, but the preference of both the youth and the guardian is asked and recorded. Now we'll look at a question from section B. You're conducting an assessment with Oscar and his mother. You determine that Oscar has an IEP. What is the next question that you should ask? You should probably ask Oscar and his mother if they wish to share the IEP. It's important to remember that caregivers can refuse to share the IEP. They may also refuse to answer school questions on grounds of FERPA, the Family Educational Rights and Privacy Act. So this question's looking at the last 30 days. Families may say that it didn't happen in the last 30 days, but it happened in the last 60 days, and that they still feel that it's important. In that instance, you can record the information in the notes at the end of the module or section. B6 and B7, Special Education. Oscar has a personal care aide who assists him at school and receives occupational and physical therapy on the weekends in his home. He's doing well at his current elementary school and with his weekend therapy programs. He also receives interpretation services according to his IEP, and his family received family counseling at school 2 weeks ago. So how would you code B6 and B7 for Oscar? I'll give you a few seconds to think about that. So we're trying to determine which services Oscar is receiving at school in the last 30 days. For question 6, we would code 6A as 1 and 6J as 1. So Oscar receives personal care aid services and interpretation services as well. It's important to note that we don't code the OT and PT as he's receiving those on the weekends and not during the school day. Additionally, Oscar is receiving family counseling services, and so we would include that under question number 7, any additional services received at school not previously mentioned. C1 and C2, goals of care. You're talking with Jacqueline, an 8-year-old with epilepsy, and her mother, Maria. During a recent seizure, Jacqueline suffered a broken leg and has to be on crutches for more than 6 weeks. When you reach the goals section of care, Jacqueline pipes in first. I can't wait to stop using my crutches. They hurt when I'm trying to play, and I want to be able to walk again without them. Maria, her mother, then adds, for me, I'm hoping to get her to take her medications better. She usually argues about it a bit and wiggles to get away from it. It's really difficult to get her to take them when I'm holding one of the twins. I would love for her to be able to take them herself, and I just have to watch her. So how would you code the individual's expressed goals of care and the primary caregiver's expressed goals of care? So the individual being assessed is an important member of the healthcare team. It's essential to ask him or her to identify what their goals might be. In doing so, the assessor encourages the individual to be an active member of the team. Use the first text box to enter any and all goals stated by the individual, and you're going to use the space after the box to enter the most important goal to the individual. Even if this goal may be duplicated from information entered in the box before. In this case, Jacqueline states that she is currently on crutches but wants to stop using them. And her primary goal would be to walk again. Her mother indicates that Jacqueline currently wiggles and argues when taking meds, and Mom wants to teach her to take them by herself. The primary goal in this case is for the individual to be able to give self meds. So now let's take a look at a question from section D. Tim was diagnosed with Duchenne muscular dystrophy 6.5 years ago, as of October 2015, and has scoliosis as a result. He receives physical and occupational therapy for both conditions. His mother also thinks that he suffers from arthritis. How would you complete the disease diagnoses? So for this item, you're going to record the diagnoses and assessment code. Make your best attempt to judge primary versus other diagnoses based on what the individual or caregiver states and any clinical records provided, recognizing that it may be possible for an individual to have more than one of each. In this case, Duchenne muscular dystrophy is his primary condition with no changes in the past 30 days. So we'd code that as a 1. Scoliosis is a secondary diagnosis or other diagnosis for which he's receiving active therapy. It's coded 3. So we should note that arthritis was not coded because it was merely an opinion, not an official diagnosis from a medical professional. Regarding Section D on diseases, we want to note that questions D1, D2, D4, and D5 focus on issues that have been diagnosed by a medical professional. Question D3, however, allows for concerns from those who are close to the individual. So now we're going to take a look at D13 and D14, assistive devices and durable medical equipment. You may complete D13 and D14 in the order that you prefer. Some assessors may use D13 as an icebreaker before delving into the specifics, while others may prefer to understand the scope of the durable medical equipment needed and use D14 before discussing overall concerns. Just as a reminder, D13 reviews concerns that families might have, whereas D14 lists the assistive devices that are being used and the assessment code that corresponds to those devices. So let's look at a sample question. Padma is a 14-year-old girl with CP. She's been in a wheelchair since she was 4 years old, and she's relied on various assistive devices such as a gait trainer, a shower chair, and a specialized car seat. All of these devices function well, except her car seat's getting too small. Recently, she's been experiencing seizures, which have decreased her ability to hold her trunk upright without support or coordinate the movement to assist in transfers. So how would you code Padma's DME needs? You'll need to list the equipment and the assessment code. And to give you a clue, there are going to be 6 items listed. I'll give you a second to look at that. Okay. So in this example, Padma uses a wheelchair, a gait trainer, a shower chair, and a specialized car seat. We can code the wheelchair, the gait trainer, and the shower chair as 1, since the family indicated that those devices function well. The car seat we're going to code as a 4, that a reassessment is needed because her family indicated that the car seat's getting too small. The family also expressed their concerns about the need for trunk support and a transfer device. We're going to code that as a 3, that a referral is needed to assess for unmet assistive device needs. During our training sessions, we had many different opinions about the assessment codes for this example. This is a case where the assessor will need to rely on their own professional judgment to determine whether we would need to reassess for the wheelchair. D17, care transition planning. So question D17 refers to care transition planning. It's only designed for individuals 12 and older, and helps both the individual and the caregiver and service planning team determine how prepared the individual's healthcare team has been preparing him or her for their eventual adult healthcare needs. Be prepared for reaction from the caregivers that it may seem strange to them to be asking these questions about their teenager. Reassure the family and the caregivers that these items are designed to help ensure proper planning for long-term healthcare needs, and it's never too soon to be thinking about these things and identifying transition planning needs. Now let's take a look at Section E, 5, and 6, Care Changes. This section deals with caregivers and social supports. Let's take a look at this example. Miley is an 11-year-old girl with Down syndrome that lives with her mother and her grandmother, Alice. Alice stays home with Miley and cares for her when she's out of school. Alice walks Miley to and from school. makes her dinner, and puts her to bed. Alex expressed concern about her assistance, though, stating that my arthritis is rapidly getting worse. I saw my doctor last week, and he mentioned that I need surgery for the next month, and I'll be on bed rest for a while afterwards. I'm not sure how much longer I can walk her to school. So how would you complete level of informal care is expected to decrease? Number 5. So we would say that yes, indeed, it is expected to decrease because grandmother Alice is going to be out for a little while. So would you need to ask more questions to determine the response to item E6? And what types of questions would get you the information that you need? To answer E6, ask something along the lines of whether or not they have considered an alternative plan. So now let's talk about section F for cognitive skills for daily decision making. This is an SAI required question and a medical necessity required question. This means that you shouldn't leave the question unanswered or enter 9. You should use your professional judgment to code the field and then clarify your response in the "is there anything else that would be helpful" field at the end of the section if you're having trouble. Let's take a look at the first example. 16-year-old Harriet lives at home with her parents. She has a diagnosis of Down syndrome. She functions well in their home, making reasonable decisions about clothes selection, food choices, and some of her daily activities, including when it's a good time to play outdoors with her puppy. However, she gets distracted in new or different environments, and she's not able to make safe and independent decisions when she's in new settings, such as talking to strangers and giving out personal information at the mall, or going into cabinets without permission at someone else's home. So if we refer to item F4, how would you complete this decision-making question? So the prompt suggests that Harriet makes reasonable decisions in her daily setting. The question is geared towards daily decision making. Therefore, we'd code this with a 1 for modified independence. She still has some trouble in unfamiliar situations, therefore she isn't completely independent. Let's look at another example. 8-year-old Kayla has a developmental delay. She functions well in the family home when activities are predictable and self-care structures are laid out for her. She can partially dress herself when clothes are presented, but rarely makes reasonable decisions independently about clothes selection, such as wanting to wear a bathing suit in the wintertime. Food choices, like taking 10 cookies to eat, and some of her daily activities, such as knowing when it is a good time to play outdoors with her puppy without support and direction from caretakers. So again, referring to item F4, how would you complete decision making for Kayla? The key to this question is that the family states that she rarely makes reasonable decisions independently. So it's going to be 2, moderately impaired. Now we're going to take a look at section I3, formal care needed. This section is about mental health and behavioral health concerns. So we're going to look at a question from this section. 2 months ago, Sylvia was discharged from a psychiatric hospital stay with recommendations that she visit a psychiatrist weekly and enroll in an outpatient substance abuse program within a month. Sylvia is visiting her psychiatrist regularly, but has been unable to find a substance abuse program with an opening. So how would you complete a formal care or treatment received? In Sylvia's case, she would need psychiatric admission, so I3 would be coded 0. She will visit a psychiatrist weekly. I3B is going to be coded 1. She should enroll for a substance abuse program but has been unable to find an opening, so I3C would be coded 2 for needed but not received. If you coded 2, you have to explain in the text, and the explanation here was that there was not an opening, unable to find a substance abuse program with an opening. The example didn't request or recommend targeted case management, and therefore the answer for I3D is 0. However, it has been suggested that had she received targeted case management, the case manager might have located a substance abuse program. Again, this is a case where you'll need to use your professional judgment. So I6 and I7 discuss lifestyle. The second to last question presents a brief look at how the individual's lifestyle may be affecting their health. And these are the sensitive questions that we were talking about earlier. The questions can be difficult for the individual and caregiver, so please proceed with added care and sensitivity. Don't always assume that just because an individual is a preteen that the question doesn't apply. While it's not a mandatory question for the completion of the SAI, you should still make your best effort to complete it. Regarding these questions on lifestyle, during our initial trials, families and stakeholders agreed that these questions were necessary. And then question 7, is there anything else that would be helpful to know about the individual's mental state or behavior? And there's a place to fill in any other concerns or observations that you may have had. Okay, and that wraps up the core. So next we'll move on to the PCAM. PCAM, Personal Care Assessment Module. The default look-back period for all sections of the PCAM is 30 days, unless otherwise specified. The PCAM consists of 7 sections. Section J, Cognition and Executive Functioning. Section J provides more in-depth questions on an individual's cognitive status. Some of the questions focus specifically on capturing changes in cognitive status that may be important for service needs. Section K, Communication and Vision. Section K focuses on the individual's ability to hear and see. When addressing the questions, code for the individual's ability with any assistive devices that they normally use. Section L, Additional Behavioral Considerations. L1 parallels Section I of the core. You may use many of the same techniques and probes that you used for that section. Section M, Functional Status. The purpose of this section is to examine areas of function that are most commonly associated with independent living and self-care. Instrumental activities of daily living, IADLs, include items associated with normal tasks and activities in maintaining a household. Section N, Continence. Section N is devoted to the individual's continence of the bowel and bladder. Section O, Sleep. The purpose of this section is to determine if a lack of consistency in sleep patterns is a complication in the individual's functional status, and if so, to what extent. Section P, Habilitation Needs. Section P is used for individuals requesting CFC services. It's devoted to establishing goals and desired outcomes for CFC habilitation. Now let's take a look at a question from Section J, Memory and Recall Ability. You're interviewing Michelle, a 14-year-old with moderate intellectual disability and attention deficit disorder. She's able to recall what she ate for breakfast. She knows all of her caregivers' names and faces along with her home and favorite places, like the park. Michelle remembers short and long-term events well, but needs cueing when performing a task such as dressing or bathing. How would you code the following section for Michelle? So we would code short-term memory OK as 0. Yes, Michelle remembers short-term events We would code long-term memory OK as 0. Yes, Michelle also remembers long-term events. We would code procedural memory OK as 1, memory problem, because Michelle needs cues when performing certain tasks. And we would code situational memory OK as yes, memory OK, as she recognizes caregivers' faces and places that she regularly visits. Now let's look at a question from Section K, Communication and Vision. You're interviewing Cynthia, a 12-year-old with Down syndrome. She was fitted with hearing aids 6 months ago, which has now made it possible for her to hear voices clearly. She's able to see nearby objects clearly, but only sees distant objects when she has her glasses on. How would you code the following section for communication and vision? So for this section, Michelle would receive the following codes. We'll code hearing as adequate, proximity vision as adequate, and distance vision also as adequate, as she's able to see distant objects with her glasses on. Now let's take a look at section M, 2, activities of daily living and self-performance. This item assesses the individual's performance of ADLs and how much help was provided by the caregiver during the last 7 days. Younger individuals may not be able to perform some of these tasks due to their age, and in such cases, individuals should be coded as totally dependent. It's important to note that the intent of this section is to determine how much assistance the individual is receiving, and not how much help you believe they should receive. Also, you should not record what you believe the individual might or should be able to do. Instead, report what the individual has been observed doing over the last 7 days. In this section, you will code for the performance, P, of each ADL and the effect, E, of the illness on the performance of ADLs. Please refer to the manual for more instructions on this section, since accurate coding is an important basis for making decisions on the type and amount of personal care services the individual may need. Be sure to consider each activity definition fully. Let's take a look at the following example. Leo is a 7-year-old with severe scoliosis and muscular dystrophy. He is able to help but needs weight-bearing support with any type of locomotion, positioning, transfer, hygienic activity, bathing, or toileting. He also requires assistance with dressing, but it's not weight-bearing. Leo also needs some hands-on help, non-weight-bearing, with eating. So how would you code the following section for Leo? If you need to pause the presentation while you code this section, please do that now. So we would code locomotion or mobility performance as 4, extensive assistance, and effect as 1. We would code positioning performance as 4, extensive assistance, and effect as 1. We would code eating performance as 3, limited assistance, and effect as 1. We'll code transferring performance as 4, extensive assistance, and the effect is 1. We will code toileting performance as 4, and the effect is 1. Dressing as 3, limited assistance, and the effect as 1. We'll code personal hygiene as 4, extensive assistance, and the effect as 1. And bathing as 4, extensive assistance, and the effect is 1. For performance, P, Leo was assigned a code of 4 for locomotion, positioning, transferring, toileting, personal hygiene, and bathing. In this example, we can see that while Leo does participate in these activities, he requires weight-bearing support for all 6. For eating and dressing, he was assigned a code of 3, limited assistance because he's involved and requires non-weight-bearing assistance. Moving on to the effect aspect, he receives a score of 1 for all of these activities, as his condition, scoliosis and muscular dystrophy, affects performance in all of the assessed areas. Let's look at section N1, bladder continence. This section assesses control of urinary bladder function by looking at how often an individual experiences episodes of being wet. However, this does not refer to the individual's ability to toilet themselves. For example, an individual can be continent as a result of recognizing the need to void and receiving help from others. An individual could also be continent with scheduled toileting plans, continence training programs, or with appliances. Let's look at this sample question. Tamika is on a scheduled toileting program. For the most part, other than the occasional accident, she's continent. During a shift change 2 weeks ago, a caregiver inadvertently missed taking her to the restroom at the designated interval, and she voided in bed. How would you code the following section for Tamika? So we're going to code this as a 2, infrequently incontinent. The example indicates that Tamika does have the occasional accident. Therefore, 2 would be the most appropriate response. The NCAM, or Nursing Care Assessment Module. The default look-back period for the NCAM is 30 days unless otherwise specified. The NCAM consists of one section with 7 subsections. Section Q, Complex Conditions and Nursing Care. Section Q concentrates on complex conditions and skilled nursing care. These items are used for identifying potential skilled nursing needs and also serve as a part of the requirements for determining medical necessity for individuals requesting CFC services or MDCP. This section includes items relating to neurological care, airway management, nutritional care, medication, elimination, integumentary care, and other skilled nursing services. Only a registered nurse should complete this section. There are multiple skip questions in this section where the answer to an item may direct you to skip to subsequent items. The nursing services for each body system should focus on formal care needed and received. Let's take a look at Q1, neurological. This question refers to seizure disorders. John's parents tell you that he has a seizure disorder. 3 years ago, he had several focal seizures and a tonic-clonic seizure. He was put on daily medication. His last seizure was on August 15, 2014. His seizures are controlled and required minimal management. Aside from daily medication, he hasn't needed any other type of intervention to date. How would you code the following section for John? Q1 would be coded 1. Yes, he does have a seizure disorder. Q1A, presence of seizures new since last assessment, would be coded 0. No. If this is an initial assessment, ask this item from the perspective of any new seizures over the last year. In John's case, he has not had any new seizures in the last year. Therefore, we would code this with a 0 for no. Q1B, seizure is 1, controlled. John's seizures are controlled with daily epileptic medication. He has had no new seizures in the last year, and therefore we code 1, controlled. Q1C, typical level of seizure intervention. According to the manual, long-term daily epileptic medication with no other interventions would be considered mild. Therefore, in John's case, we would code this 1, mild, minimal management. Q1D, type of seizures. John has been diagnosed as having tonic-clonic seizures and focal seizures. Therefore, we code 1, general, as 1. Yes. 2, focal, as 1. yes, and 3 other as 0. Q1E, date of last seizure is August 2014. Q1F, frequency of interventions. This item refers to interventions for breakthrough seizures. Since John hasn't had any seizures since August of 2014, he has not used any interventions. Therefore, items would be coded 0 for never used. Please refer to the manual if you have any questions about this item. Let's look at a sample question from Q10, nutritional. James is an 8-year-old boy with cerebral palsy and accompanying difficulty swallowing during each meal. He therefore receives bolus feedings every 4 hours during the day with an NG tube of gauge size 14. Despite daily care of the tube site, his nostrils are turning red from the pressure at the tube site. He has been tolerant of tube feeding, and his weight is normal for his age. How would you code this section Q10 for James? Question 10, enteral feeding, would be coded as 1, yes. We'll code 10A, frequency of enteral feedings, as 1 via bolus. We'll code that with a 1 for less frequently than or equal to every 4 hours. 2 via drip as 0, not used, and 3 via pump as 0, not used. We'll code 10B, gauge size of the tube, as 14. 10C, tube site care as 1, needed daily. At 10D, appearance of the tube site as 1, tube site is red, we'll code that with 1. 2, tube site has signs of drainage, 0. And 3, tube site shows other problems, we'll code that with a 0. MDCP, Medically Dependent Children's Program. The MDCP consists of one section with 10 subsections. Cognitive patterns, mood, behavior, functional status, bladder and bowel, diagnoses and conditions, skin conditions, nutritional status, physician care, special treatments, procedures, and programs. This module is used only to gather information used to calculate and assign Resource Utilization Group, RUG, which is used to determine the MDCP cost limit or budget for the individual. None of these items in this section of the SAI are used for medical necessity determination. The assessor should explain to the individual that these questions may seem duplicative of the items in the core, PCAM, and NCAM, but that the time frames for the questions are different. The assessor should also explain the different purpose of this module. The default look-back period for the MDCP module is 7 days, unless otherwise specified. Let's take a look at a sample question. This is R4 and R5, communication and memory. Obi, a 10-year-old boy with Asperger's, is able to remember all 3 words you ask him to remember: sock, blue, and bed, on the first attempt. How would you code the following section for Obi? So we would code R4, individual is under 7 years old, or individual is at least 7 years old, but rarely or never understood, as no. We can understand Obi. R5, repetition of 3 words. For this item, Obi would receive a score of 3. Obi was able to remember and immediately repeat all 3 words called by the assessor. Therefore, Obi would be assigned a code of 3. If Obi were to score less than a 3 for this item, he would be given 2 more attempts, where the assessor would repeat the words using cues. For example, sock, something to wear; blue, a color; bed, a piece of furniture. Let's look at item R6, temporal orientation. When you ask Obi what year it is, Obi tells you it's 2016. You then ask what month it is, and he tells you September, and he's excited because he gets to start attending Lego robotics classes next week. When you ask what day of the week it is, he tells you correctly. So how would you code the following section for OB? So we would code 6A, able to report the correct year as 3, correct. 6B, able to report the correct month as 2, accurate, within 5 days. And 6C, able to report the correct day of the week as 1, correct. R7, recall. You again ask OB to recall the 3 words mentioned in question 2. He is able to recall all 3 words without cueing. How would you code the following section for OB? So we would code that as 7A, yes, no cue required. That would be a 2. 7B, we would also code with a 2. He remembers with no cue required. And 7C, we would also code with a 2 that yes, OB can remember with no cue required. R8, summary score. Use the information you were given for OB and how you coded the previous questions. So what is OB's summary score? And the answer is 15. And that concludes the STAR Kids Screening and Assessment Instrument Training. If you have any questions or comments, please feel free to contact us.